either from a supine position on a mat or in a half squat against a wall. Execute the back to mat or wall shoulder flexion, 1 set of 10 repetitions. Ensure that your lumbar spine is flush to the ground or to the wall. Start with your hands directly above your chest, extended elbows, reach back as far as you can. It's not to try and get to the ground, it's to try and make yourself effectively as long as possible. Key point is moving back to the starting position, ensuring that form is maintained. From a standing position, the preference is to do this with your back against the wall, executing a wall slide with 3 contact points: upper back, elbows, and the outside of your wrists. Try and maintain these contact points throughout the movement. If you're really tight in the anterior capsule and you feel like you're losing those 3 contact points, start by regressing the exercise to face the wall first until you're proficient at the movement pattern, and then execute the exercise in the preferred way, which is with your back against the wall. From a side lying position, execute the 90-90 stretch, 90 degrees at the hip, 90 degrees at the knee. Here, what you're looking to do is continue to make sure the movement comes from your thoracic spine. Execute the nice full rotation by not taking your eyes off your hand at any point. Gaze directly at the hand all the way around as far as you can. Make sure that your arm doesn't veer behind your acromial line. Stay in control at all times. Make sure that the leg that's on the foam roller maintains contact with the roller itself. If you're pretty flexible, you don't need to have the foam roller in position. Exhale at the end range of movement. Inhale, returning back to the starting point. From a side lying position, make sure your spine is in a neutral and deloaded position. Execute the sleeper stretch. This is forced internal rotation, stretches out the posterior aspect of the shoulder girdle. This is a really important exercise for countering the effects of anterior humeral glide and rounded shoulders. Will allow your head of your humerus to be sitting in a better position in the shoulder labrum. So from a 90-degree position, keep a nice stiff wrist, no flexion at the wrist itself. Just apply downward pressure for a 3-second hold, and then fully externally rotate all the way to the ground, return to the starting point, and repeat on the other side. Assume a figure of 4 position over a foam roller, applying downward pressure to the middle to top part of your glutes, gently rolling backwards and forwards. Apply pressure on the most sensitive part of that area for 30 seconds per side. Keep a nice neutral spine and a steady head position, maintaining your balance on the roller. Execute the quad foam rolling. Start sort of to the middle to top part of your thigh. Start in the middle and then work your way kind of inwards and outwards depending on where the most sensitive areas are. Be sure to make an effort to spend as much time in the top part of the quad as you can. Assume a sprinter start position, turning your foot slightly inwards, and roll out the tibialis anterior. This is responsible for dorsiflexion of your ankle. You want to preserve the mobility in the ankle joint itself, so make sure that you put downward pressure, creating almost sort of a sandwich effect between the bone and the foam roller itself. Repeat the same on the opposite side. TP stands for trigger point, so make use of one of those trigger point balls. The larger one would be most appropriate at the beginning. Get about a 45-degree angle with your arm position and get a height kind of nipple line region. And once you're applying downward pressure towards the wall, just bend your knees going up and down cross-frictionally to release the pec muscles close to the shoulder juncture. Same pressure point. This time allow the pressure to remain constant in one position and then dynamically move your arm in sort of a half circle motion against the wall. Maintain contact with the wall with all your fingers throughout the full range. It's quite sensitive and tender. Repeat the same on the opposite side to loosen up the pectoralis. Also using a trigger point ball, this time we're going to roll the posterior aspect of the shoulder girdle itself, making sure that we look after not only the anterior capsule but also the posterior capsule. You can spend some time rolling around the rotator cuff itself, so you can start with a side-to-side motion and then combine a side-to-side motion with that of an up-down motion. So it will be up and down, side to side, up and down, side to side. Nice and tender on that particular area. You'll know exactly when you're on the right spot. Spend some time just ensuring that we maintain the integrity of the tight tissue around the labrum and overall shoulder girdle. Facing the wall, assume a position that's going to be 3 foot lengths away from the base of the wall itself. So right, left, right. Sit into your right hip if you're a right-handed thrower. The same would be the case for a lefty from the opposite side. So once you're sitting into your hip, without overarching your lumbar spine, keep your head in a neutral position. Assume a 45-degree angle with your hands and arms and lift at 135 degrees away from the wall itself, essentially like you're pouring water out behind you out of a glass. Assume a supine position with the foam roller position just underneath your shoulder blades. Keep your head in a neutral position, hence the hands being held at the top of your head itself. Execute a nice compact thoracic extension movement. When you get to your sticking point where you feel like you can't go much further, I want you to exhale without arching your lower back. Maintain the contact point with your hips as well as with your feet against the ground at all times. Everything stays nice and compact, elbows close together. The key factor here is to make sure your head does not drop back. Keep your head neutral and ensure the movement comes from your back itself. Assume a side-on position next to a TRX, roughly shoulder height. Nice short lever. Get a neutral grip with your hand position so that we engage not only the forearms, but get ourselves in a uniform position orientated toward the TRX. Sit into a deep squat position, and once you've assumed that position, there should be tension on your lats when you do this. From that position, execute a nice deep lateral breathing sequence. So inhale, expanding your diaphragm. As you do so, continue to maintain pressure on the lats, exhaling and then lowering your butt slightly towards the ground even more. Repeat for 10 repetitions to get even length on the lats. With the foam roller positioned in front of you, 1 foot flared out to the side, here we're going to work on ankle mobility as well as adductor lengthening at the same time. So shown from both the front and side-on views, keep a nice neutral back position, head's nice and steady. Exhale at the end range, repeat the same on the other side. Once again, we revisit the trigger ball. The diagram will show you roughly the area that we're looking to isolate. So you want to be putting the trigger point ball directly in that hip flexor junction, particularly towards the top end of it. And we're going to go cross-frictionally side to side to try and loosen the hip flexor itself and the pressure that it's placing on the pelvis and on the quad around the integrity of your pelvis. Also with the trigger point ball, this time we're moving a little bit more laterally into the TFL area. This is quite tender and sensitive, so be very careful with where you position this. You'll also know, as you did with the shoulder girdle, when you're on the correct spot. This is a side-to-side motion. Rest on your elbows so that your back stays in a neutral position and is not overly rotated. If you're super time efficient, there's a supplementary section of the corrective sequence in phase 1. A couple of areas you can reinforce would be the adductors. So assuming a semi-side-on position the roller on the inside of your thigh, and then roll over as though you're getting into a prone push-up position, and then going back to the side-on position each time. Apply direct pressure on the inner thigh. The prone shoulder series is the Super 7 sequence, 7 different movements, starting with movement number 1 for 5 repetitions on each side. So here you want to keep a nice neutral wrist position, keeping your shoulders relaxed, keep your pelvis nice and heavy, and your lower half uninvolved in the movement itself. So it's 5 repetitions on the one side. You'll be restricted on your non-throwing arm, a little bit more so than you would on your throwing or layback dominant arm. Movement number 2 is to lift both elbows at the same time, ensuring that your hands maintain contact with your head when you do this. This is a nice shoulder girdle series that's going to pay attention to and isolate all the key movements and small muscles in the shoulder girdle and upper part of your back. Movement number 3, This time we take our fingertips or fingers rather out to a T position, thumbs pointing upwards toward the ceiling. We do 5 repetitions of this particular movement, squeezing between the shoulder blades. Every movement's a slow and controlled movement sequence, particularly on the way down to the starting point. For exercise number 4, let's get into effectively the skydiving position or goalpost position, and we're lifting up, really engaging the middle part of the traps as well as the rhomboids. No involvement with your lumbar spine, keeping your head down. Exercise 5 of 7 is to combine effectively the skydiving or the goalpost lift into an overhead press. So lift into the goalpost position and extend out in front. Lead with the elbows returning to the starting point each time, pulling down as though you want to pull your elbows into your back pockets. Exercise 6 out of 7 is to do what we call the Ys. This is very similar to the 135-degree liftoff off the wall. Here we're trying to isolate the lower part of your traps. The key point here is to reach as far forward as you can before executing the lift. Once again, be careful on the way down when you return to the starting position. And lastly, with the Super 7, reach in front of you to execute what's called the swimmer's hover. Effectively going to combine all the movements by starting straight overhead, creating a nice circular motion, rotating the palms so that they face upward, and place them over the lower part of your back. Return to the starting position from there in the reverse motion. So rotate your hands back with the palms facing down again. So once again, start with the palms down. When you get about halfway, rotate them inwards and place them in the small of your back. Pause briefly and return your hands back to the starting point again. Focus on your breathing. It's a nice, slow, controlled movement. It needs to be very much a glide-like movement that is smooth and flowing and not be stop-start and rigid at any point of the range. Try and maintain that there's an even effort on both dominant and non-dominant sides. Supplementary exercise number 3 is to combine the preacher pose, which is going to once again put some emphasis on your thoracic spine, trying to get extension in your thoracic spine as well as a bit of a lat stretch, and then working your way into the Cobra or dolphin pose, which will extend, create a little bit of relief on the lower back as well as to stretch out your abdominal cavity. So combine this movement by doing 3 of each. So really sink the hips with a heavy pelvis downward toward the mat, lift your head up, getting some good extension in the lumbar spine and a nice stretch in the anterior aspect of the core musculature. Pause briefly when you get to the preacher pose. So this is Cobra pose, and once you go back to the preacher pose, maintain a good body position throughout with a straight back. Lastly, we can do some foam rolling of the lower leg or calf area. The harder way is to do it with one leg crossed over the other, creating effectively a sandwich effect. But the other way is also just to do both legs at the same time with the even distribution of the load. Base this on what your tolerance level allows for.